space here. Head sits on top. First two vertebrae go right in. Atlas and axis, right? First two vertebrae. Then you have the 7 cervical, right? So that's the first 2, 3, 4, 5, 6, 7, right? 7 cervical vertebrae. Now when I go to the next one, that's the first thoracic. You'll see the rib is attached to it, right? It connects to it. So it's your thoracic vertebrae. 12 thoracic vertebrae because you got 12 ribs. Now sometimes it varies on people, right? Now notice though, your cervical went this way, right? And notice the thoracic goes this way, right? So if your head and your thoracic are sort of in the same alignment, right? After the 12 thoracic vertebrae, then you have 5 lumbar vertebrae, right? 5 of these guys. Now look inside and you see it go up. You see the shape of the bone, right? Notice how it goes from thin up there, and it thickens as it comes down to the sacrum, right? And notice the angle too. So the lumbar comes back in almost just like the cervical, and the thoracic goes out. So you have your head, thoracic, and now we have our sacrum down here, which takes that same round shape, right? Just like those other 3 points.
Yeah.
Right? And then you have your tailbone, your coccyx. See it? You see how it rounds back under?
Yeah.
Right? So, and it rounds back under, and then when you go out from it, you have your sits bones, ischial tuberosities. Let's just sit on, right? And that's part of your 2 iliac crests, right? So your pelvis is your sacrum, the 2 iliac crests, and they come around to the pubis, right, where it forms in the front, right? And then you have what's called your pelvic outlet, because that's where things, of course, flow out, right? And then your organs are sitting in here, right? But then you go to the side here, and you have the acetabulum, which is the name of the socket here, where the femur, the head of the femur, which is a ball and socket joint, meets, right? Now, if you look at your thigh bone, right, you have what's called the lesser trochanter and the greater trochanter. It does a little hook, right? It goes out and it bends in, and it comes down, long shaft, and then you get to the knee, right? Well, now look at this. We think about anatomical terms. So closer to our center, proximal, distal. So if it's closer to the center, it's proximal, distal, right? So we got the distal end of the femur, right? You have your patella that's just in front, which is the stabilizer of the knee. It's a sesamoid bone, right? And there are 2 other sesamoid bones that are in the body that are right underneath your feet, or right underneath your big toe metatarsal. These guys aren't really sort of movable here, but in your body, there are 2 little pea-like bones at the base of your feet. Then you have your tibia and the fibula, right? Tibia and fibula, bracing. Then the end pieces here, your malleolus, medial malleolus, and lateral malleolus. If you look at your ankle bone, you'll see them. Then you have the talus and the calcaneus, 3 cuneiform, navicular, and cuboid, right? Metatarsals here, and then the phalangeals, right? So those are your feet. Now, all the other bones we haven't really gone over is the shoulder girdle, right? So the shoulder girdle. So you have your rib cage, your thoracic rib cage, right? Comes around from the back, meets in the front at your sternal, right? You got your mandible and xiphoid processes here, right? Now the collarbone, this is a saddle joint, right? So if he was mobile, his shoulder would saddle up, the shoulder blade would go up and be able to go down. So you have your collarbone, right? Meeting at the acromion joint here. And then you have the spine of the scapulae, right? So this little piece that sticks out, the medial border of the scapula and the lateral border of the scapula, right? So your little angel wing, and that meets right there, right? And so then here, where the shoulder comes in, it's another ball and socket joint, but you can see it's not as full as the femur, right? So it's called a demi-socket, and the glenoid fossa is that actual space that's there on the scapula where it meets. The humerus comes and it just meets right in with the deltoid fiber right over there to hold it, the cap, shoulder cap, right? So you have the clavicle, your scapula, your humerus, right? Then you have the radius and the ulna. Now, if you think about which bone is which, so the thumb side, right? right, it rotates over the pinky side of the hand. So this bone here is called the radius, pronation and supination.
Oh yeah, I fractured my radius.
Right? So that's that bone there that goes out. Everyone knows a little funny bone, olecranon processi here. You know, when you hit it, boom, right? So, and then once again, you got carpals here, and then you got phalangeals and tarsals all the way, metatarsals all the way out there.
Where are the lungs?
Right? So those are the bones, Mr. Bones.
Where's the lungs at?
The lungs? So your lungs are going to be housed inside the rib cage, right? So,
Up there.
right? Up into the body is divided into several different sort of spaces here, right? So if you think about it, air and all of the wonderful stuff happen here with your lungs and your heart, and then you have your actual visceral cavity here where you have all your organs, right? Your liver, your spleen, your stomach, right? Your gallbladder, your large and small intestines, right? Remember, your ascending colon comes up on the right, transverse colon goes over to the left, winds around, and descending colon down and winds through to the pelvic outlet, right? So the lungs are here, right, inside, right?